Today I am at King's College Hospital, London, Dubai, with Dr. Farooq, one of my favourite doctors. Not a favourite subject though.
No.
I loved talking about liver.
True.
Because we love our liver.
We do indeed.
But today we are talking about colon and colon rectal cancer.
Colorectal cancer. So
Are they different?
it is a part of the gut. It's a large intestine, but yes, they are managed differently.
So what is the difference?
So it really is, it's just a part of the gut it involves. Largely they are the same. We do treat more or less the same, but depending on where exactly the cancer is, we deal with it differently. So different surgical techniques, different surgical procedures, and different way that we approach.
So if you've got your colon, which is a long
It is very long, yes, that's right, it's a large intestine.
Rectal will be
The last
near
bit,
the rectum.
yes, the very last 15 centimetre part of it.
Right. So that's the main difference. The colon, whereas colon cancer can be anywhere else in that.
In the colon, the rectum is the very last bit.
Tell me, is there an age group, an age, a sex? How do you find it? Why would I be worried?
So previously, we were led to believe, and we always thought the greater the age, the greater is the risk. And the age bracket at that point was 60s. Even back home in the UK, we've started reducing down to 55 and to 50s. But I think largely it depends on the region where you are, ethnicities, or some genetics, of course. For example, here in UAE, we recommend this to the age of 40.
Well, has the age changed, or is it just more research?
It's more research, really. I think we now know significantly that this is a type of cancer that if we catch early, we can deal with it better. Not only that, but the most important part of this is that actually we can stop it happening, which really has changed how the world now looks at colorectal cancer. Which is, we know that one of the ways it develops is polyps.
Yes.
So therefore, for the audience, what polyps, I normally explain, a lot of my patients, well, what is polyp really? Do you know you have warts and moles on your skin? That's exactly the outpouchings on the lining of the colon. They're generally really not cancer. Majority of them are not, of course, depending on the size and the nature of it. But the sooner you find it, the better it is. The earlier you find it, you just remove it. As a part, we now consent people during colonoscopy that we will remove the polyps if and when we see them. And that reduces the risk significantly.
Because baby polyps aren't cancer.
No, as I said, there are different types of polyps, many of them, and most of them are not cancerous at all. However, they have the tendency to become one. So for me, it's extremely important to find it in somebody who is 40 years old, because if I don't, there is a significant risk that by the time he or she reaches 45, 50, that polyp has started to change its morphology.
Right. Now, these are found with colonoscopies?
There are different ways. There are invasive ways and non-invasive. There are screening ways of it. And depending on your risk factors, depending on your age, I think we recommend that you at least have what we call a poo test. Yes, you heard that right. It's a poo test.
Yeah.
And we here at King's, we do it exactly as we do it back home at King's. We reduce the threshold even lower to 10, to be honest, because I've done research and we now know the level is a 10 in this stool test. So,
right.
So you do the stool test, you get the kit and you do it in the bathroom and you bring it back to us, we test it here. And if this is called FIT test, F-I-T, it's basically immunochemical test that we do, try and catch blood in the stools basically, or traces of blood. And if it is found, then I think the next step really is that you go for colonoscopy. Right. Now, if on the other hand, you already known to have polyps, or you have family history of cancer, and or you have cancer in the past, then I don't think this test really adds a lot of value. The thing really is that you should go straight for colonoscopy. And we have different guidelines for different groups.
Also, if you're interested in long-term health for yourself, a colonoscopy surely is the gold standard just go in, get the colonoscopy, and then you know that you're safe for
Indeed.
quite some years.
Indeed. Particularly if you are in UAE, your age of 40, then I think you really should think about your colon and the way you approach it. There are different factors. There are low risk, there are high risk groups. Then you have symptomatic and asymptomatic patients. So until now, all we were discussing was about asymptomatic patients. So somebody like you and me walking down the street, no symptoms, very fine, knows, oops, I actually have turned 40. It's the time that I need to look after my colon.
Right. I had a colonoscopy here, and I have to say it really wasn't as bad as I thought it was going to be. I think I was more embarrassed about the whole thing, but the doctors here, I was with Dr. Regina, and the doctors here really do make you feel like it's just normal.
That's true. That's very true. And this is exactly, you actually made a very valid point. One of the things that we have found in patients, particularly females, is the reluctance and the embarrassment attached to it. And I really wanted to reassure that we have a really excellent and a well-experienced female colleague that we'd be more than happy to refer to her, and you'd be more than welcome to come and see her if that is the concern, but don't ignore the colon.
And then you're just knowing that it's all well and that you don't have to worry about it. Just put it in your diary for 10 years down the line and go.
True. Depending if it's normal. If we have found a polyp, then we will tell you at the time of discharge. Yeah. And when do we want to see you again, please?
And then approximately how long, if you did have a polyp, how often would you?
Right. So it could be 1 year, 3 years, or 5 years, depending on the size and the site of the polyps, really, and the numbers of them. So very quickly, if you have polyps which are more than 3, 4, and 5, and or one of them was a centimetre and above, then we'd prefer them to come back within a year to 2. Really, on the other side, you could do that 3 years. Don't forget, family history also plays a part. And if you have a very strong family history, like a first-degree relative who have had colon cancer before the age of 50, then for us, you're high risk. So whether we have found a polyp or not, we may ask you to come every 3 to 5 years.
Right. Does this affect men or women more?
Genetics-wise, really, I think we think it's more men really than female, but it's equal distribution, to be honest. Both are at risk, particularly if there's a family background.
So this doesn't happen to young people generally.
That's true. We would be surprised to see it in somebody in their 20s. But that said, I have seen somebody as young as that, but they then had genetics, very strong family genetics, or syndromes as we call.
Right. What would be your, okay, go back to that, which we've discussed before. If you had a billboard on Sheikh Zayed Road, what would you tell people so that they can actually read it while they're driving?
40, colon, look after it. It really is. It really is. The second most common cancer in UAE. Can't ignore that.
People don't really know that. The second, what is the first?
Of course, there are like breast is very common. There are other cancers which are very common, but colon cancer is extremely common. And the other thing, what I think your audience should know about is the lifestyle. Somebody asked me the other day, can I prevent having a colon cancer without having to do colonoscopies, really? And my answer was, of course, no. But yes, there are things. Who gets it more common if they don't have family history or they don't have genetics for it? So lifestyle, sedentary lifestyle, overweight people, obesity. I'm not trying to take you towards fatty liver, of course, but these are these. But
although it's your favourite subject,
of course. That is really very, very common.
Right.
Then diet is also very important, and in this part of the world, so low fiber diet, the diet which is rich in carbs, rich in saturated fats, red meat, the more it is, the more the risk. So one might think, yes, it could be the dietary effects, because if you look at the diet that's get consumed in this part of the world, they really are rich in all the top 3 things that would cause this, and very low in fibre.
So you're telling people not to eat red meat?
No, this isn't. They need to add more fibre to their diet. So stopping red meat wouldn't take the risk of cancer away completely. You would still, at the age of 40, and all symptoms will need it. But I think there's certainly a role of healthy diet.
And many people, when you say you need roughage, they think, I eat rice, I eat bread. They're highly processed and tend to be white.
True.
So what are you talking about in the form of roughage?
So it's brown rice. If you're really very focused on, or this is your staple diet, that's fine. But you could have brown rice. Similarly, bread, change it. I normally say, look, go for whole meat, seeded bread. If you can go for that's more organic, that's got more fibre content. We now have brown pastas for that matter, for European descent people who'd like to have pastas in their meal. That's absolutely fine.
Has all of that got anything to do with getting everything through your system faster and
That's
it
right.
not sitting?
That's right. And this, it does come to the exhaustion and the working of the colon, really, that meant or supposed to be one of the factors or the risk factors for changes within the gut, changes within the microbiome of the gut. And there's a lot of factors that leads to it. Polyps per se, they can be familial, they can be genetics, but they could be sporadic. And to be honest, sometimes we just never know why one would get polyp. They'll get it, and therefore we said, right, blanket cover, 40, asymptomatic, this is the time you need to look into your colon.
So would that come under a health check at 40?
Yes, we colonoscopy at the age of 40. We here at King's do offer multiple levels of health checks, and colonoscopy is part of it.
So everything that we talk about comes down to exercise, at least moving, whether that's walking or running, and a healthy lifestyle in the form of good food. Fibre,
roughage more, exercise and water. Hydration is also very important. Having ensured that you had 2.5 to 3 litres a day would also keep your bowel going, if not clean, if that makes sense.
Right. There's a lot of food for thought.
There are lots of changes that we could bring it by our own selves, in our own kitchens, really, the way we eat, the way we look at things. And that's got significant health benefits.
And quite easily done. A processed meat, I think, is something that there's some confusion. People don't even know they're eating. If you go and buy food, cold meats, it isn't even comprehended that they are processed.
True. No.
That the processed meats are not good.
No,
at all.
No, not at all.
So buy real cuts of meat.
Proper fresh cuts of meat if you're really going for.
What should people look out for if they're the symptoms that they should be looking out for?
Right. So thanks for asking. This really is very important. Whilst we talk about asymptomatic screening through the poo test and or colonoscopy, it's equally important for people to look out for symptoms, to be aware of that what if this is happening, I need to go and see a doctor. So the most thing is blood in the stools. It's common reasons first, of course, and we have piles, we have changes around the rectal, inner rectal end that can cause this, but don't ignore this. See someone. It's important, particularly if you are above the age of 40. The other symptoms, change in bowel habits. I used to go once every 2 days, and this is normal for me, but actually in the last 2 weeks, 3 weeks, I've been going every day. And my stools are becoming like very mushy, like a porridge, 3 to 4 times. and they're coming out without any effort, as it were. So I'm having to go. So this is a clear change in the pattern. All right, you don't have to shout loud day one, but if this is happening for a couple of weeks, then again, don't ignore it.
I was going to say, so a couple of weeks is, if the change continues for a couple of weeks, then
I think you really do need to see someone at the least. I'm not suggesting that please present yourself for colonoscopy at day 14.
Right.
But if it's something that carries on and is different for you,
yeah,
without an established trigger, then I think you should really go and see someone.
So it's not just what you had for supper last night that changed your bowel habits for the next 48 hours.
True. Third thing, sometimes people get abdominal pains, discomfort, bloating. Now, I don't want to send unnecessarily alarms. This is a very common symptom, particularly in younger people. But if this is carrying on and there is no specific trigger for it, with or without bowel change, then again, you need to go and see someone.
Which area would the pain be?
Tummy pain. So lower abdomen. So lower abdomen, bloating. I'm getting constipated. I didn't used to be. So this is again a change. And lastly, and very importantly, is weight loss. If you started losing weight and due to any reason, and you can't really put a trigger on, I haven't been trying really.
So you're not supposed to be happy about that?
Well, no. If you haven't really tried for it, then you need to find out why. And yes, it's not always the colon that you're losing the weight from.
Right.
But I think this is something that should at least trigger you to go and see someone.
Right. Okay. So we've got weight loss, stool changes,
changing bowel habits,
and pain.
So abdominal pain, that's
blood.
Really important, and the blood in the stool. And
that can happen anytime to anyone. It's just if it continues to happen.
Indeed. And very lastly, and more importantly, is anemia. Now, women between the reproductive age, it's not seen as that problem really, because of course there are reasons they can get anemic. Particularly for men, if they're getting anemic at the young age, that really needs to be looked into. Again, I'm not suggesting that if you're anemic, your first test is colonoscopy, but you do need to go and see a doctor because you're anemic and you really need to know why. There may be hundreds of reasons why you're anemic, but I think one of the very important reasons, iron deficiency anemia, that could really point towards colon cancer, particularly if you age over 40, and men really, because they don't have reasons to get anemic otherwise.
Wow. Dr. Farooq, thank you so much.
My pleasure, as always.
Spreading the word.
Thank you so much.
So we love our liver. Last time we talked about that, I said, do you eat liver? And you said, why would you eat your friend? And what are you going to say about the colon?
Just look after it.
Just look after it.
Colon looks after you all your life. And we all know that if we haven't really done what's our routine, we feel very uncomfortable, we don't perform, we don't function normal, we don't do things at the right pace. So just look after it.